afternoon. It's a great honor to have the opportunity to communicate with experts from different countries. This study I report is a qualitative study of family resilience in patients with refractory epilepsy. First of all, please allow me to take a moment to introduce my work unit. The first hospital of Jilin University was founded in 1949 and located in Changchun City, Jilin Province in China. It's a large-scale hospital affiliated to Jilin University, which is directly subordinated to the Ministry of Education. Last year, the number of patients in emergency department was over 4 million. This is my personal resume. I will report on the following 5 aspects. As we know, epilepsy is a chronic brain disease. When patients had taken standardized treatment with more than 2 drugs, still cannot control the seizure. We call it refractory epilepsy. About 70 to 80% of patients with epilepsy can control their seizures with drugs, but there are still 20 to 30 of patients will not, and they have to take effective drug therapy or surgical treatment. There are more than 50 million epilepsy patients in the world, and there are 400,000 to 600,000 new cases in China every year. The population of my hometown is over 24 million, and the number of epilepsy patients had reached more than 200,000. Family resilience, a dynamic process in which a family can effectively use its internal and external strengths to face the life pressure. The family members work together to resist pressure and difficulties and achieve good family adaptation and development. It was proposed by an American psychologist named Michael Kirby in 1988. It focuses on how a family generates strength work when they are in the face of adversity. The chart shows the structure of family resilience, which consists of 3 main processes: family belief system, family organization, and family communication process. In face of stress, the above 3 factors gain resilience in a series of interactive processes. Most patients with refractory epilepsy have a variety of seizure types. They often accompanied by impairment of intellectual or cognitive function, social adjustment ability, or personality changes. Some patients need surgical treatment or still have post-operative seizures. One girl in this study was still having post-operative seizures that are difficult to control with drugs. Because of the disease, patients with refractory epilepsy will always have heavy psychological burden. Their quality of life was decreased, so as their caregivers. The purpose of the study was to understand and identify the characteristic of family resilience in patients with refractory epilepsy in Chinese cultural context. Phenomenological study method was used. There are 12 participants who were caregivers of patients with refractory epilepsy. The patients had received treatment in the first hospital of Jilin University from January to September in 1923 in this study. We took face-to-face, semi-structured, and in-depth personal interviews with participants. There are 2 members in the interview team: the moderator and the reporter who took manual notes. The first hospital of Jilin University gave its ethic approval to carry out this study. The moderator began by explaining the objective of the study, the audio and video recording of the meeting, the data confidentiality and asked the participants whether they agreed to participate. All of them signed the informed consent form and filled out a social demographic data form. The same accessible room was used to all participants. To avoid interruption and distraction, a signboard indicated that the meeting was being recorded. The verbal content of the discussion was transcribed anonymously for further analysis. All of the material was carefully stored in a security filing cabinet, where only the team's researchers had access. The interview lasted approximately 30 to 40 minutes each, and at the end, participants were given a small present to thank them for their collaboration. This is the interview outline. The inclusion criteria for the participants were shown here. Firstly, the patients was diagnosed with refractory epilepsy more than 1 year, and their caregivers had taken care of them for more than 1 year. The caregivers had normal mental and emotional self-control and memory. Lastly, caregivers can express their feeling verbally and agree to participate in this study. And the exclusion criteria were that caregivers who were unwilling to participate in this study, or caregivers who cannot communicate normally or have mental disorders, or to care of patients with less than 1 year. Here's about analysis of the data, including the social demographic data and the interview data. After the interview, the CLISI 7-step method was used to analysis. Firstly, we read it and stored the data. Then we find out, code, and classify the meaningful node. We extracted the theme and list the description, identify similar views, and return to the participants for verification. A report on the research result will follow. Table 1 shows the demographic data of the 12 participants. It can be seen that most of the caregivers were female and the nursing time ranged from 2 years to 40 years. Only one of the participants believes in Buddhism and the other have no religion. There were 3 themes and 11 sub-themes were extracted. Theme 1, participants with refractory epilepsy have a strong sense of family faith. This theme includes 3 sub-themes. Firstly, participants had positive view dominate. Secondly, the positive and negative evaluation of the strengths were existed. Lastly, their personal beliefs are absent or few. Theme 2, the family resources were underutilization. The 6th sub-theme of the second theme were that family function mode of the patients were slightly rigid. The family cohesion, family problem-solving ability, and family economic support were good, but their family communication ability was yet to be improved. The third theme were that there were many external support resources which can basically meet the needs. The 2 sub-themes of this theme were that patients with refractory epilepsy got more support from family and community. This table shows in more detail of the positive and negative views on each topic and the description of the participants. In family cohesion, several participants said that the illness had brought them family close together, caring and supporting each other, and receiving more greetings from other family members than ever before. In terms of family financial support, most participants said that other family members gave them some degree of financial help, and only one participant said that other family members aided her in case she borrowed money from them. In terms of personal belief, one participant believed in Buddhism and the other 11 participants had no religion, but most of them said they believed in science and modern medical technology. They believed that with the scientific treatment, the participants would definitely achieve their goals of seizure-free. Only one of the participants who was poor and her doctor had been ill for 40 years said her personal faith had collapsed. Community supported is convenient. Yeah. In China, the community provides economic subsidies of 5,000 yuan and provide necessary help for patients with epilepsy. The participants whose family was rated as the household enjoying the minimum living guarantee, and she mentioned that the members of community had voluntarily donated money for her. Several of the participants who were financially well off said the community had called them to ask their situation, but they refused to accept the help of the community. This study identified that characteristic of the family resilience in patients with refractory epilepsy in Chinese cultural context. They had a strong sense of family faith and underutilization of family resources, but they could abandon social support resources to meet the needs of patients and their families. This study further explained the needs of family for home nursing services and provide a reference for the curriculum design of epilepsy specialist nurses training, such as adding psychological support skills for caregivers. The study indicated the recommendation on how to better assist patients and families in family care in the future, such as developing multidisciplinary cooperation, deepening family-centered care in health education of patients with epilepsy, helping family better cope with the disease, and improving family resilience. It also would help them to make full use of family and social resources. In addition, the study design can be applied to qualitative studies of patients with other disease to find out the key question in the research field. As mentioned before, in the context of Chinese culture, our study find family resilience characteristic of refractory epilepsy patients, such as slightly rigid family function mode, strong sense of family faith, defects in family communication ability, insufficient use of family resources, and so on. At present, more community support and sufficient external medical support can meet the needs of the patients and their families. The limitation of our study is that most of the participants in the study were female, and they were the mothers or wives of the patients. There were less data on fathers or husbands. The caregivers have different relationship or family structures are not discussed in subgroups. And there were also no subgroups analysis of caring years by length of time in our study. This could be further studied in the future. There's an let's see. Yeah, there's an old saying in China. There's no fellow son at the bedside throughout the parent's illness for a long time. But in our study, the reverse is different. Parents will not give up their children. There are even family members who had taken care of her doctor for 40 years, which is also a manifestation of Chinese people's strong sense of family faith. There's also a possibility that participants in our study had received treatment. The pessimistic patients who give up are not included in the study. With the attention paid to humanistic nursing in China and the growth of the post-19th population as parents, the characteristic of the family's resilience in patients with refractory epilepsy need to be further studied to provide a basis for family-centered care in the future, as well as a reference for the training source setting of the epilepsy specialist nurses training. More attention is paid to the caregivers who take care of the patients will be suffering from depression. That's all. Thank you.